Now, a vaccine authorized in December for use in India, Corbevax, may help solve one of the most challenging problems in global public health: how to supply lower-income countries with a COVID vaccine that's safe, effective and affordable. Corbevax uses old but proven vaccine technology and can be manufactured far more easily than most vaccines right now. Indian vaccine manufacturer Biological E Ltd is making this vaccine, and now we're joined by Dr Peter Hotez, one of the developers of the vaccine, which has been designed in the US and made in India. Thank you so much for joining us, Professor and Dr Peter Hotez. And first and foremost, before we talk about the vaccine, I want to ask about the US, and it seems the US is going to be past this wave of coronavirus, past the Omicron variant. What is the situation?
Well, we don't really know, because what's happened in the United Kingdom, for instance, it started to come down and then it got stuck about halfway down and it continues to plateau now. So, we hope that the trajectory goes down as quickly as it went up in the United States. But we won't know till we know, and so next couple of weeks will really let us know. Eventually, this will subside, but I think we have to get ready now for the next wave that will almost surely come over the summer.
All right, let's talk about the vaccine now. So tell us about the Corbevax vaccine, which is being produced by Biological E here in India. And how soon can we expect this vaccine, to be used in India? And also tell us how it's a lot cheaper than other vaccines and gives hope to other developing countries.
Yes, so this is a vaccine that uses an older technology similar to the recombinant hepatitis B vaccine that's been in use in India and globally for several decades now. So it's produced by microbial fermentation in yeast. It's actually a vegan vaccine, which people find kind of interesting. And we do this because this is the lowest cost vaccine, and yet it works, we think, as well as any of the mRNA or adenovirus vectored vaccines. So we developed this vaccine at our Texas Children's Center for Vaccine Development, which makes global health vaccines. And we've licensed it with no patents or strings attached to 4 vaccine producers so far. Others will follow, to Biological E in India, to Biopharma in Indonesia, and Septa in Bangladesh, and Immunity Bio, which is building capacity in Southern Africa. BioE, of course, is the most advanced of those producers in terms of its track record of making the World Health Organization pre-qualified vaccines. It's an extraordinary organization of scientists and industrialists run by Mahima Datla, and they've now produced 250 million doses and have capacity now for 140 million doses per month to make 1 billion doses. And as of last month, the vaccine was released for emergency use authorization in India. And I think the plan now is for Biological E to work with the World Health Organization to get it either pre-qualified or emergency use listed globally, so it can make a contribution not only for India, for the world. And there's several steps in that. And in the meantime, they're looking at this vaccine not only as a standalone vaccine for 18 and up, that's how the emergency use authorization went in India, but also now there's pediatric trials going on, so as a pediatric vaccine, as well as a booster for vaccines that are not working well against the various variants. It could help, especially some of the Sinovac vaccine, which is not very strong, from China, which is not very strong against the variants. This could be a booster, or for some of the others.
Right. In fact, that's what we heard here in India, that perhaps it would be used as a booster. Now, the priority needs to be that this vaccine needs to be, quickly produced and then shared as well across developing countries if we're to stop another wave.
That's absolutely right. And because I think, we've learned now that the Delta variant, of course, arose out of India in the early part of last year, and then Omicron out of Southern Africa. And so Mother Nature is telling us what she has in store for us. That is that the major variants of concern will continue to rise out of low and middle income countries in the Southern Hemisphere and elsewhere. And so that means it makes it especially important for that commitment to vaccinate the world. And that's been unfortunate that the countries in the Northern Hemisphere, the US, Canada, European countries, the UK, very much looked after themselves and made enough vaccine for themselves and interesting new technology vaccines. But there was never consideration about the rest of the world. And that's what's very special about India. India has got enormous capacity for producing vaccines, has been making the vaccines for the world for decades. This is, I call it India's gift to the world. And I think that's going to be a really important story, that ultimately it's India and countries like India that save the day in terms of COVID-19.
Well, thank you so much for saying that. And are you hopeful now that the developed countries, as you said, the Northern Hemisphere countries, have now realized that it is no point giving booster after booster to their own citizens if they're not going to help ensure that other countries are able to vaccinate their populations as well?
I think we have to change the vaccine ecosystem. It's too dependent on the multinational companies and North America and Europe to kind of hand a few crumbs over to the rest of the world, and we cannot operate that way anymore. The big vaccine producers in India deserve global support. I think that's one. Also, there's still very much a colonial mentality out there, and what do I mean by that? Well, in terms of global use for a vaccine, you can work through the World Health Organization, or as an alternative path, you can work through one of what are 6 so-called stringent regulators. And then that is adequate for dissemination globally. And who are the 6? US, Canada, Australia, the European medicine agencies, UK, and Japan. So what's missing there? Of course, what's missing is the developing country regulatory authorities, even though they've got enormous experience. India, Brazil are on the outside looking in, like Jude the Obscure, and we've got to fix that, right? I think I've been very impressed with the Indian Regulatory Authority, the DCGI. They are deserving to be considered, I think, a stringent regulatory authority, as is maybe 1 or 2 others, and that's going to be the answer as well. It's, there is this colonial style control over the vaccine production facilities and release globally, and this all has to change. And if we've certainly learned this with COVID-19, because the consequences for the low and middle income countries have been devastating. The African continent remains unvaccinated pretty much. Much of Southeast Asia remains unvaccinated. Many countries in Latin America remain unvaccinated. It's unacceptable. And the way you fix this model is you have, the multinational companies, I have nothing against them. They do important work. They contribute to the Gavi Alliance, but we cannot rely only on them. And we cannot rely only on the regulatory authorities in North America and Europe. What we've got to do is broaden this to include the vaccine producers in India. They are deserving of that status. The vaccine producers in places like Brazil and their regulatory authorities, and broaden the governance for global health to be more inclusive.
All right. So just donating vaccines is not enough. Donate the know-how as well, the intelligence behind it. Doctor, what do we know about, the Omicron variant now, in terms of reinfection and immunity?
Well, we're still learning. There's a new preprint that came out on medRxiv yesterday, and it's suggesting, and again, it's still early on, that Omicron infection is not producing very durable immunity at all, and may resemble some of the upper respiratory coronaviruses. So what that means is even after this Omicron wave passes through India, passes through the US, we will still be vulnerable to the next variants to come.
And what does this mean now? It seems like it's going to be this endless cycle of, getting more boosters of the vaccines and more variants emerging?
Well, we don't know for sure, but I don't think so. I'm actually more optimistic. I think if we can empower organizations like BioE to really help vaccinate the world, I think we can end this pandemic, but we have to enable them to do that. And we have to let BioE make those billion doses and deliver it for the world, and maybe other organizations like it. And that's the answer. But the bar is high. I mean, if you think about the numbers, right, there are 1 billion people in sub-Saharan Africa, 1 billion people in the smaller low-income Southeast Asian countries, 1 billion people in Latin America and the Caribbean. That's 3 billion people. If we're talking 2 or 3 billion doses, that's 6 to 9 billion doses. And that's where people fail to understand the scale of this. I mean, the Biden administration boasted, and I like President Biden quite a bit, but he boasted that the U.S. government has done more than any other country in terms of donating doses, 400 million. It's not anything close to what we need. We need 9 billion doses, and we don't need it by 2023 or 2024. We need it now. And so this is why we've got to empower organizations like Biological E to let them do their work and not put roadblocks in.
All right, thank you so much, Dr. Peter Hotez, for speaking to us here at NDTV, and thank you for your work.